Hi, everyone. I'm Sumeet Bhatia, founder and CEO of Aiva. My colleague Sarah and I are going to discuss some of the most common questions nursing and informatics leaders have about a new and really important category, AI nurse assistants and ambient documentation. Our Aiva Nurse Assistant application was one of the first commercially available solutions in this space and is still the leader. Quick background on me before we get started. Before Aiva, I co-founded a company called Tiger Connect, one of the first clinical communications platforms. And I started Aiva about 10 years ago with a mission to create a personal and professional voice assistant to help healthcare professionals and patients. So I'm excited to share how Ava is empowering nurses who make up the largest part of our healthcare workforce with our new voice-enabled assistant product. Sarah, turn it over to you.
Hi, I'm Sarah Visker. I'm a nurse. I've been a nurse for 20 years. So the first half of my career for 10 years was in bedside. I did med-surg nursing and women's health nursing. And then I moved into informatics leadership. So I've worked at both adult and pediatric organizations for informatics leadership. And now I'm here at Ava Health as the director of clinical informatics. Happy to join you, Sumeet.
Thanks so much, Sarah. So I'll just dive in and get us started. We're going to do sort of a Q&A format. So Sarah, why is AI for nurses getting so much attention these days?
Yeah, so we kind of say nobody needs an assistant more than a nurse, and we've seen a lot of work done for our provider counterparts. Just nursing just really needs that help. We're seeing nursing shortages and nursing describing their documentation load as crippling. So what that ends up looking for nurses is over the course of their 12-hour shift, they have to do upwards of 800 data points. And that looks like thousands of clicks and thousands of drop downs. And on top of that, they have to work through several other disparate systems. Like I'm looking up policies and procedures. I have to get into another system to put in work orders. I have to find an iPad to do clinical translation. So the nurses really need these tools at the bedside so that they can kind of get back to why they became a nurse and do that care for their patients.
Thanks, Sarah. And so, what do you think are some of the key benefits of this technology for nurses and for hospitals and health systems?
Yeah, so already we're seeing benefits for both. And what our nurses are saying and what the hospitals are saying is that it's already reducing the nursing administrative burden. So caregivers are saving time. They're able to get information to the rest of the care team in a more timely manner. They're able to also decrease that incidental overtime. So that time that I have to stay after my shift to do documentation when I should be, home with my family. And that's not only important for wellness for nursing, but also a financial impact on the organization. We're also seeing one of our hospital partners just recently presented at AONL that they're seeing more complete documentation, which is really great for our regulatory compliance. So making sure that we're getting all of those required elements completed. And we've also seen patient and family satisfaction increase. So having that face time with the patient and not having my back turned, entering data into a computer, being a data entry specialist, and actually being able to have that face time with the patient has improved patient and family satisfaction rates upwards to 35% on their nursing sensitive scores.
Wow, it's really amazing to hear some of those like direct outcomes and how these types of technologies are impacting nursing workflow and care. We hear a lot about physicians and ambient AI as well. What are some of the key differences between ambient AI for physicians versus nurses?
Yeah, so providers they give their care in more of a unstructured note format. So I'll go into a note and it'll type more in paragraph note format. The amount of data points that they have to do is in around 150 to 200. And it's done maybe once a day, or if the patient has an issue, and maybe twice a day on those patients. Nursing has discrete fields, so very discrete documentation. I have infinitely more data points to enter, and then I'm doing it multiple times, sometimes upwards of hourly throughout my shift. So it's that constant demand and that discreteness that makes it much different than providers. So we're finding that solutions that were like developed for providers or to provider workflows really can't transition smoothly into nursing, that we really have to shadow nursing identify their workflows and find something that works for them and get them at the table and really getting their feedback with anything that we develop or implement.
Yeah, amazing. It really does. I think you need to take that opportunity to walk in their shoes as much as possible, and you have the benefit of having walked in their shoes. So it's great to again have something that's built right alongside nurses.
Yeah. So Sami, I know people have a lot of technical questions about how this actually works. So do you mind kind of taking us behind the curtain here a little bit and just kind of letting us know how this AI voice charting for nursing actually works?
Yeah, great question, and really, there's a number of different components that make up an AI workflow, and one of the first parts is converting natural speech into text, and then taking that text and having an understanding about what a nurse is trying to document, and turning the speech into ultimately like structured, discrete fields. So if you think about a giant form, effectively that a nurse has to fill out, and all the different fields that they have to potentially click into and select a bunch of options, what we're doing is taking that natural speech, converting it into text, and then checking all the appropriate boxes for them and filling out all the different forms effectively, that giant Excel spreadsheet, filling that out on their behalf.
So like we said, the nursing has so many data points that it's so complex to get when you get into the body systems of things like cranial nerve reflex and things like that. So how does are you finding that the AI models are able to handle that really complex nursing documentation?
Yeah, that's something that we've really worked very diligently at. It's something where we've learned a ton, working again side by side with nurses. It's definitely a tricky problem, and we are able to do exactly that, Sarah. We're able to understand, what the nursing workflows are, and all of the various types of documentation that they need to do, and we're able to get just the right information to the right part of the chart, of the patient chart. And what's also been amazing is the system is really great at capturing not only discrete data, but if you have a comment about something, you're able to easily add that as well, so that some of that narrative as well can be easily added alongside the all of the discrete data.
Yeah, that's such a great feature because we all know like every person is unique, right? And patients don't fit into check boxes. So having that where I can get my data in discreetly, but then also add, the comments and narratives that really outline the story of that patient is really helpful. So I know, cybersecurity is top of mind right now for a lot of organizations. What are we doing to help keep this voice technology secure for the hospital systems?
Great question. HIPAA and privacy and security are always top of mind when dealing with patient information and PHI. So the application is completely HIPAA compliant, leverages the latest and greatest in encryption in order to make sure that we are protecting this information. And then another key component, as you think about, or as we think about, what's the best workflow? We always have the nurse, or human, what's often called human in the loop. They will be part of that process. They will speak, and then they will verify before anything enters the chart. So that's a really a key component. And what's great is we can do all of that in real time. So they can speak, they can see a table, they can verify, all within a few seconds before submitting. Just want to have that extra check before they write something to the patient's chart.
Yeah, that's so great, right? Because like AI is not a nurse, right? So being able to have that human in the loop that we're able to augment nursing care with AI, it's definitely not a replacement, but able to augment it and hopefully make our nurses' lives a little bit easier, taking off some of that burden.
Absolutely. So, Sarah, earlier you talked a little bit about time savings. Can you tell us more about how much time can nurses really expect to save with voice documentation and ambient documentation?
Yeah, so right now we have more than 2.2 million rows having been documented by voice. That's across nursing and also our nurses' aides, which also get a lot of value out of the tool. And we're seeing the documentation is being put in 90% faster for when you look at latency. So from the time a nurse does an
Awesome.
observation to the time it actually makes it to the computer, usually an hour to an hour and a half, sometimes upwards of 2 hours can have passed because I kind of carry that information around in my mind till I can get to a computer and get it in. So we've seen the latency drop from hours now to minutes and near real time, like in within 1 to 2 minutes of the time the observation is happening. And then, like I said, we saw reduction in incidental overtime. So nurses who have to stay after their shift for documentation, one organization saw a 55% reduction in that incidental overtime. And that's even paired with the higher Press Ganey scores. Like I said, a 35% increase in their Press Ganey scores. So it's really showing that they're able to get from the facing the computer and feeding the data and having that face time with
Mhm.
the patient.
Yeah, again, it's amazing to hear about that direct benefit, direct ROI for the individual nurses, and also for the benefit of the patients and the organization, the hospitals. So, how does this technology, yeah, improve patient care and safety?
Yeah, so for safety, that latency and decreasing that latency is really important. So the data that is driving all of our other AI tools, like predictive models, like sepsis predictive models or deterioration index, early warning systems, they're only as good as the data that's being put in. So if your data is an hour to 2 hours old, you're flagging those patients so much later. So having the data put in timely, and then even things that are not as high tech, like for example, just documenting your ins and outs. So how
Mhm.
much is the urine output? How much IV fluid has they have the patient gotten in? Having that information being delayed, getting it to provider, the patient's going to get their bolus, an hour to 2 hours later than maybe they should have. So we see that communication throughout the whole team is allowing patients to get interventions earlier. And then with access to policies and procedures, being an informatics nurse, I can't even tell you how many times I've been a part of a root cause analysis where something went wrong and a nurse didn't access a policy and procedure where we had a policy for it just because the barrier of doing it, having to leave the room, log into a computer, read through, documents that are sometimes upwards of 17 pages long to get the information you need. Being able to use AI to search those policies and procedures and have it right there at the point of care, right where you need it, and it answered in a succinct way, like a one line with additional information. That's really empowering the nurses to get the knowledge and the evidence at the bedside so they can implement it into care right away.
Yeah, it's such a great use case for the AI technology in general. Again, helping folks in the moment that they need that assistance. I know we talked about it a little bit earlier, but if you could elaborate more on the ROI that an organization, a hospital can expect from implementing this technology.
Yeah. So number one, the quick return on investment, like we said, is that decrease in the incidental overtime. That to some hospitals that bill is upwards in the millions. So that's a quick win of like low hanging fruit. If we can make nurses more efficient and they don't have to stay over to do documentation, that's a huge financial win for an organization. We're also looking at nursing retention. So if I'm able to bring the joy back to nursing, will they stay at the bedside? Replacing a nurse is very expensive, and we're seeing organizations have turnover rates in the 14 to 15%. So if we're able to kind of stop that bleed and keep the nurses that you have and keep that knowledge at the bedside, that's an also it's it has a financial impact, but then it also has an impact to like your unit, your culture, and keeping that knowledge at the bedside. There's also reduction of errors if I'm able to bring information and make it actionable at the bedside. So I'm not, doing something because it came up in a Google search or I asked somebody who maybe didn't know and wasn't reliable. I can go straight to the source and get that information directly at the bedside.
Yeah, amazing, great points, and thanks so much for sharing.
So I know we talked a lot about documentation and policies and procedures, but there's like so many other areas that nursing needs help with. One that comes top of mind to me, just having been a direct care nurse, is entering service requests. That is something that was always a pain, and frankly, something I never did as a direct care nurse. I just put a broken post-it note on things and kind of went on throughout my day. So, how can AI help with things like that, where it's administrative work? It's not in my nursing scope and standards of practice, and it's taking me away from the bedside. Is there any way AI can help with things like that?
Yeah, really, it's one of those areas where we're so excited. We know nurses spend, 25 to 40%, maybe a little bit more of their day in the HR and charting and doing that documentation. However, there's so much opportunity to help with the other 60 to 75% of their day as well. So, one such area is, as you just mentioned, like entering a ServiceNow ticket, or an IT service management ticket of some type. So with partners like ServiceNow, you have the ability to just speak and go ahead and have a ServiceNow ticket created, an incident created, and what we see, as you just mentioned, things get underreported. So lots of
Yeah.
times we hear you get to the floor and you need a piece of equipment and it is unavailable to you. So there's just really a great opportunity to make sure that all of the equipment that is required and necessary for a clinician to do their work is readily available. And just in general, like voice commands save nurses time and ensure ultimately like better reporting and resolution as well.
Yeah, that's so great. Those things that just kind of add up through your day when you're trying to care for a patient. I've heard them described as like pebbles in your shoe. They're just little annoyances throughout the day that are just pain points that really take away the joy that there is in nursing and taking you away from the patient. So that's really great. You're able to tackle things like that. So how does Ava working with other AI models like ChatGPT and Claude?
Yeah, another great question. I think there's today, Ava has, we believe, the best front end application for inpatient nurses to leverage, launch, speak really quickly, review their results, and then confirm and send it to the chart. In the future, and that we believe that future is now, Ava can work directly with frontier model applications, products like ChatGPT for healthcare, Claude for healthcare, Gemini Enterprise, Microsoft Copilot. These types of products are becoming more and more prevalent inside of healthcare institutions. And so, as part of an organization's workforce strategy, we can connect into those products, leveraging technologies like MCP or Model Context Protocol and A to A technology from Google, agent to agent. And all of that centers around this idea, similar to ServiceNow or policies and procedures, of connecting into leveraging our, at this point, 40 plus connectors to connect into all of those systems that a nurse may interact with throughout her or his 12-hour shift.
Yeah, and that's so important. I think people don't realize the amount of context shifting that nurses have to do to know how all of these different systems work, how to log in, what the screens look like, where the buttons are in them all, and just the amount of that adds to their cognitive burden. So having one interface that's easy to use that I don't have to remember how everything works or where to locate it is like game changing. So
Yeah, absolutely. We want to sort of prevent that context switching
yeah.
that we were talking about, and going from a phone to a workstation on wheels to the desk computer, going to the intranet or those different sites. We just want to make this entire process as simple as possible.
So what does an implementation look like for a hospital if they decide they wanted to move forward with ABA?
Yeah, they really we want to work alongside their governance structure within their organizations, and we know that that may be multiple different parts of the organization to really affect this change. And what's really amazing is we are able to do this in 6 to 10 weeks from discovery and all the way to launch. So this is something that an organization can implement really, really rapidly and
Mhm.
quickly, and have some of those great outcomes that you mentioned earlier.
Yeah, and I'll say that the discovery process is my favorite. I love getting on site. I love talking and learning from the nurses and getting their input and interaction in the governance right up front, so that they're like the owners of this, right? I feel like often nurses feel like technology ends up happening to them, versus being co-designers and co-developers of the technology that's going to help them support their practice. So I feel like that's really great.
Absolutely, Sarah. You've mentioned that before. Working alongside them in that
Mhm.
discovery phase. I think you've shared every organization we have the opportunity to partner with in that manner has benefited the entire ecosystem because we'll
Yeah.
learn more and we'll have an opportunity to do more with them and provide that functionality to every organization and to nurses everywhere. So really excited about that.
Yeah,
Um,
nurses are the best innovators. So when we come to them, they say,
Absolutely.
"This is really great. Let's do it all. But also, could you help me with this other problem that I have?" So it's really great to hear every place we go what innovation they end up coming up with. It's yeah,
I,
nurses are brilliant innovators.
Absolutely. It's one of the things I equally love the most about that opportunity to sit down with them and talk through things with them. Sarah, thank you so much for the time today. That's what we have for now. And for folks watching, listening, please reach out if you have any questions and look forward to talking again soon.